7 to 8 days, to be precise, in the last 8 days, including today. We always start with the 6 pillars of our COVID-19 response. You know, it starts with the comprehensive health response, the food security and social relief, enhancing the capacity of the state and its agility to respond to disasters, including this specific pandemic, the economic response, social mobilization and human solidarity, and lastly, law enforcement and compliance. We always start by giving you a national picture, as announced by the minister last night, in terms of the number of cases, positive cases. In our country, we are at 27,403. As you would know, with 12,456 recoveries. And the breakdown per province. Oh.
They say the mask is distorting the sound, if you don't mind.
I am told the mask is distorting the sound. Is that the case? Members of the media, is that the case? So you are requesting me to take off my mask? Is that the case? Good morning. Let me start again by saying that we always give the update that first starts with what the national picture is, as announced by the Minister of Health by last night. The figures are known to you: 27,403 confirmed cases. And in terms of the recoveries, it's 14,370. Those who have passed on, 577. And the national tests conducted, 655,723. We take in interest as we look at the national picture to just say where our province is. In terms of the confirmed cases, Gauteng currently contributes 12% to that national number of confirmed cases. And I always say, you remember, we had moved from where we were contributing 52% to the confirmed cases in April to this point where we are at 12%. In terms of the active cases, of those confirmed cases, Gauteng contributes 10% to the national active cases. And the active cases are very important because that's really where the attention is for whatever intervention. The focus is on the active cases, the contacts with whom those who have tested positive have had interaction with, as well as hospitalization, those who need medical interventions. It is the active cases that the significant attention is paid to. In terms of the national recoveries, you would see that we have 14% of the national recoveries. In terms of death, our province contributes 5% to the national number of people who have passed on. So let's zoom in now. That was the national picture. Specifically, what has happened in the last 7 days? Since the 20th, where were we when we did the last briefing? When we did the last briefing, we had 2,400 confirmed cases in Gauteng. That is last week, Thursday. And out of those, we had 72% recoveries, which was 1,729. We had 27% active cases last week, Thursday, and we had 27 people who had passed on, which is 1%. At that time, it was 1%, to be precise, 1.1% of the national number of people who have passed on. So, 8 days later, we have an increase over the last 8 days of 929 cases. And that's positive cases. That's the precise number of people who have tested positive in the last 8 days in Gauteng. The recoveries over the last 8 days have been at a 61% rate. The mortality rate has, precisely the case fatality rate has remained at 1%. It hasn't changed. And the number of active cases has also increased from 27% to 38%. We are going to be sharing with you. So what has changed and where has this change come from? And what is it that our public health response is doing to intervene based on this data? Because our strategy is informed by evidence, it's informed by data. We are tracking what is coming through and direct our resources and energies accordingly. Every week we share with you this graph that shows basically the positive cases in our province. There was a long period where they were steady. The number of increases were steady, smaller, below 100 cases. You would see that over the last 8 days, in the last week, there's been a significant increase. And there were days where we were recording over 100 cases. We are going to show you precisely when. The number of recoveries, we always watch that. When there are more recoveries, it's good for us. But you can see the recoveries has leveled. That's not what we want. We want the recoveries to always be more. You can see the number of active cases has spiked. So we have the graph is inclining on the number of active cases. We're going to indicate to you what has happened in the last 8 days and where has this come from when we look at the regional data. So we share with you here a picture of when we were in level 5. Just before the national lockdown, our province the numbers were shooting up daily. The daily infection rate reached 124 on the 28th of March. That's like the largest just around the time of the start of the national lockdown. And it was a result of the pre-lockdown surge in the number of positive cases. So you would see from the national lockdown, level 5, we had a variation of between 50, 51 cases, sometimes even got to 9 cases a day, and went up at the start of level 4, we went to 91 cases at the start of level 4. And in the last few days since the start of level 4, we have been, the number of cases, daily positive cases has been between 26, as you would see, and at the very most 75 cases. But on some days we were recording much fewer cases. But from last week, you would see from last week we started recording. We went back to 112 cases, particularly on the 23rd, May 23rd. We had our first largest increase in the number of cases. On May 23rd, we recorded 112. On May 24th, we recorded 100 cases. And on the 25th of May, we had our largest number of cases ever. That's 260 positive cases a day. And that so far has been the largest. The number came down to 50. We're sharing with you, we're indicating to you that over the last 2 days, we are back to 100 and something, 124 on the 27th, and 162 on the 26th, and above 150 also last night. So you would basically, what is the critical observation you can make here is that over the last 8 days, we have been recording the larger number of cases than we have had even before the lockdown. And it is important when we think about where these cases are. That's the next slide I'm going to share with you about the regions. So firstly, let's say to you, last week when we briefed you, last week Thursday, the regional picture, out of the 2,400 positive cases, the regional picture last week Thursday was like this. Johannesburg had the 1,238 positive cases with 1,036 recoveries and 190 active cases. You'd see, followed by that is Ekurhuleni, which has 549 cases that were positive cases, 395 recoveries, and 146 active cases. And Tshwane had, amongst the metros, Tshwane had the lowest number of active cases, which were 99 active cases, but 344 positive cases and 241 recoveries. I want to draw to your attention to 2 districts last week. So those 2 districts, Sidibeng, it's more or less still the same. In the next slide, I'm going to show you what has changed. And many of you would know what has changed. Look at where the West Rand was last week, just 8 days ago. Only 72 positive cases in the West Rand, 43 recoveries, therefore giving you 26 active cases. We only had 26 active cases in the West Rand. What has changed this week? So you can see, if you look at Johannesburg, look at Ekurhuleni, look at Tshwane, look at Sidibeng, the increases there have not been surprising. There's been no big surprise in any of those 3 metros plus 1 district. The increases have been steady. We are going to share with you today also where they have been coming from, which specific, no longer just sub-district, but also we will share with you which wards in each of our metros and how many cases in those wards. And if you say that we have had this 929 cases in 8 days, it is very important that our public health interventions are also informed by understanding where have these cases come from and why. And what is the source of outbreak? Is it a cluster outbreak? What's the source of that outbreak in that area for us to be able to intervene? So you can now see that suddenly the West Rand, coming from where 26 active cases, the West Rand now has 244 active cases. And most of these cases have happened in Merafong. That is that Mponeng mine that we visited with members of the media. You were there, some of you were there when we visited the West Rand and had a discussion with the mining houses. So the mining sector. So the story of this week is that the mining sector has contributed substantially 21% of all those new cases that have occurred in our province in the last 8 days have come out of the mining cluster. 21% of those. Last week we shared with you the sectors that are of great concern to us, the sectors which we have been working with, engaging, and we said to you, we had also been looking at the mining sector elsewhere in Limpopo, the outbreak there in Limpopo in a mine, and we said to you that we are going to be engaging the mining industry on this, and it has indeed happened in the last 8 days that more cases have come out of that. So the point is, last week we said to you we were concerned about the dynamic in Ekurhuleni, especially in the northern part of Ekurhuleni, a sub-district called Ekurhuleni North N1, North 1, and Ekurhuleni North 2. Basically, those areas in Ekurhuleni last week which were of concern are the northern parts of Ekurhuleni from Kempton Park right up to Tembisa, including the part of Johannesburg which is Ivory Park. Last week, when we said Ekurhuleni is a hotspot, it was a result of a cluster outbreak that basically came from a factory in Centurion, which employs a lot of people who live in Tembisa and Ivory Park. It is out of that factory. We shut down that factory already by last week when we shared with you the information about our intervention there. We had already shut down the factory. We had tested the people in both communities, Ivory Park and Tembisa, and we had also isolated all the contacts in that area. I am happy that people have been recovering substantially. Those people who some of the test was done 2 weeks earlier. Of course, we know that some of the important things we are also dealing with is about, as we are quarantining people, we also waiting on the results of the tests. So far, we have been able to contain that area. That is the area in Ekurhuleni and in the Ivory Park, Tembisa area, out of a factory which is called Farmhouse that employed 400 people, and out of that we tested the workers in that and found that there were workers who were positive in there and they live in the townships. We traced their contacts and we have been able to quarantine those. We are observing them. There are persons, they are called PUIs, persons under investigation. Am I correct, Dr. Masuku? We are still watching those very well, very closely. And whilst Ekurhuleni is no longer the concern it was for us last week, the northern areas of Ekurhuleni, because of the containment measures we have put in place there. So the key focus is in the West Rand, correctly. So you would know that the President announced the hotspots in the country. Gauteng metros, the 3 metros in our province were part of the national hotspots. Tshwane, Johannesburg, and Ekurhuleni are still part of the national hotspots. And a hotspot is defined as a district that has 5 or more active cases per 100,000 population, or a district that has a high number of new positive cases over a short space of time. It could be over 7 days, or it could be over 14 days. Just at one go, a significant number of active cases. And on Wednesday, we did indicate that given what's happening with the mining areas in the West Rand, we ourselves have identified the West Rand as a hotspot because of the number of cases that we have in that area over the last 8 days. And a hotspot basically requires, once an area is a hotspot, so we have 3 hotspots in Gauteng announced nationally, the 3 metros, but the West Rand, according to us, requires that level of elevation to be made another hotspot with, so that we can do what? We can increase the level of vigilance over that whole area, including all the mining houses, and that is why we met with the mining houses, the 4 mining companies in the West Rand, to look at everything that they are doing, including ensuring that they will work with us, firstly on the number of cases that we have there, those workers who have tested positive, and secondly, on all the contacts we have been tracing. We have traced over 200 contacts in the communities in the area, including putting in place safety measures just to make sure that we test more people. We are doing so, we are testing more people in the communities, but also working with the mines to test more workers in that area, so that we know the fullness of the spread of this. That's what we did in Ekurhuleni North when we had that cluster outbreak. When we have a cluster outbreak, we direct our resources there, test as many people as we can, and trace the contacts and quarantine those. We have done that also in the West Rand. We have quarantined all the contacts that we have been able to trace in the West Rand, and we are working with the mines to ensure that all the hygiene, health and safety and social distancing measures are put in place. But if you understand that what we are doing there in the West Rand is what we have done in the areas, even in the early hotspots, we always explain to you, our first hotspots were in the suburbs. We have learned a lot from dealing with those by making sure that in the suburbs it was easy to self-quarantine or self-isolate, but we had to do lots of contact tracing at that time and ensure that those contacts themselves are isolated or are in self-isolation. So as we move, what we call the shifting geography of hotspots, as we move, every 7 days we may have a new hotspot. And that's, I would like people to understand. Once an area is, even a local area, a community or a ward is defined or designated as a hotspot, it doesn't mean it will be a hotspot forever. It depends on the sort of interventions that are there. And very successful interventions lead to the containment in the area of the spread, leads to recoveries, the treatment of those who need treatment, who have tested positive. And in many areas in Gauteng, we have seen that the number of recoveries, people who would have tested positive, has been very high, on average 74%, and in some of our regions even much higher. And that's what our interventions in hotspots would be. So, but we now have, as a result of the measures announced by the National Minister of Health, we have also enhanced our hotspot strategy. Our hotspot strategy will go beyond what we used to do before, which was testing and contact tracing and isolation or quarantining. But now, because of the changing geography of these hotspots and the new dynamics, particularly the hotspots in the townships and in the informal settlements, they need a very different approach. We have, as a result of that now, we have teams at ward level, ward-based teams, and we are now every day when we receive information coming out of the NICD, announced by the minister, these are the number of cases you have in Gauteng. Every following day, we now look at those numbers, break it down, no longer just in terms of the districts, no longer just in terms of the sub-districts. We're now taking that, breaking it down into the number of people in every ward and in every community. To look at 2 days before, how many people were positive in that community and what has happened now. We are directing teams now, the ward-based COVID teams, which are multidisciplinary and multi-sectoral teams, which we are establishing in all wards in Gauteng. So we're now establishing, we reported to you last week that we have a ward-based strategy. We are now establishing ward-based, COVID ward-based teams. These ward-based teams will be multidisciplinary and multi-sectoral. They will include experts, public health experts. Amongst those would be the Cuban Medical Brigade and our local public health experts who are operating at our primary healthcare system. They will also include community healthcare workers. So at every ward, we would have a team that's looking. So every other day, we do a breakdown of the number of positive cases in your ward. And this information is now getting sent back to our ward-based teams. We have been establishing these ward-based teams in the last 7 days to manage the next phase of the pandemic's trajectory and progression, especially in the areas that where we have high density numbers. It would not be easy to cope by using the strategy we have used earlier on, where the pandemic is in the townships now. We need a ward-based response, including at ward level to identify areas of high risk, shopping centers, shopping malls, public transport nodes where people are not observing regulations, are not observing social distancing, they are not wearing masks, spaces where our children play, spaces where people who would like to exercise are doing that. So we also want to make sure that at that ward-based level, we also include community leaders, sectors who will be represented, various sectors at a ward level. Because to tackle this pandemic at the scale that is required, it cannot just be government alone. Especially to get our people to change behavior, it can't be the police who go around policing the behavior of people. We would like social mobilization at community level for many people to understand, and leaders, including now that we are going to level 3, we're going to have various sectors of the economy open. We're going to have the religious places of worship, religious facilities will be open. So the ward-based team approach will also help us in ensuring that every place of worship in that ward, every public school in that ward, the schools are opening, every open space in that ward, every transport node in that ward is also monitored, as I said, including shopping centers and the spaza shops where our people come together. That this is a collective effort to ensure that we all comply with the measures, the hygiene measures. But the ward-based teams are also attending to other ailments. Those ward-based teams will also be dealing with the work that our teams ordinarily do. Our health team with the NGOs deal with HIV and AIDS. They deal with TB and other chronic diseases. So these ward-based teams will not just be dealing with COVID-19, because we know comorbidities are very much responsible for most of the death. So we don't want to ignore that. So if you want to understand the Gauteng hotspot strategy, is that it is a comprehensive strategy, firstly based on data. On a day-to-day basis, we receive this data. We break it down into the minute granular level, ward level, how many cases in that area. We also want these ward-based teams to be able to provide support to those who have tested positive. Instead of allowing the stigmatization of COVID-19, these ward-based teams will also be able to ensure that communities understand when you have COVID-19, you need support, you are still human, you will recover, yes, some may pass on, but we want to ensure we deal with stigma as well. We also want to use these ward-based teams will help us direct properly the efforts of where food support needs to go. You know, in terms of food, our food supply, we were having a general approach that's based on where the need is. But now we want to direct it also to where the problem of COVID-19 is. A ward that has got more COVID-19 cases in an area of high vulnerability where many people don't work, where many people are hungry, that ward will also receive more support from food security interventions, as well as other overall government support. So we now share with you data, some granular data that says to you in different areas of our province, in the different metros. In Johannesburg, we show you the data that shows you that a certain part of Johannesburg that included Four Ways, Diepsloot, Kayasent, Dainfen, Midrand, up to Lanseria was designated as a region in Johannesburg. It's Region A. That region was a big concern in the earlier days. But you'd see they only have 17 active cases at the moment. So whereas they've had 202 positive cases, they only have 17 active cases. The recoveries are so substantial in that region. Yes, we are continuing to monitor the areas there, even in that region, like Diepsloot, very closely, Kayasent. So we are showing you region by region. In Johannesburg, that's a sub-district. You go to Ekurhuleni, where were most of the cases. You would see what we said is it's Ekurhuleni 1, and Ekurhuleni, that's N1, that's the northern parts of Ekurhuleni, and the N2, both northern parts of Ekurhuleni, and Intswane. We're also showing you where most of the active cases are so that we can make our interventions. But you will now see, in that same, we show you that the West Rand, again, the sub-district called Mirafon City, that's where the mining outbreak has taken place. That sub-district has 130, in just one area, 130 cases have happened in one specific area. If you add them with that 83, that's where we have more than 240 active cases. So in 1 week, basically, you can have an area where the cases were few. In 1 week, that could change into many more cases. And that helps drive our interventions. We're also going to be doing this regularly to say to you the top 20 wards in Gauteng. In other words, the top 20 wards where we have more cases. And I want to explain to you that by more cases, sometimes the cases may appear few. Look at Carltonville. This is what the Mirafon, the mining area. So you may have a ward there that has got 23 cases. But if you take the whole area as a sub-district and add those cases, there will appear more. So we don't want to wait until an area, a ward has got too many cases. That's the point I explained last week. And once we identify that in a ward there are this number of cases, very often for us 10 is big enough. When we have 10 cases in a ward or in a community, 10 is big enough to require a significant intervention from us. And you'd see we even track up to 4 cases in other parts of our province and our municipalities. So this is also changing. So the top 20 wards in Gauteng that have got more cases, it's something that is changing every week. Next week, we may present a different picture. You may find that there are a lot more recoveries in these wards, and another area has emerged as a hotspot. We will do the same. So when I said to you that we want ward-based teams that have information about where to intervene, to inform our testing strategy, to inform our tracing strategy, to inform where we need quarantine and isolation resources, to also inform where we are going to need more beds, people who may need hospitalization. This is based on data that's now being drilled to that level. We are further sharing with you the different wards. Again, the numbers may appear quite small, the number of infections. The point we are making here is that in this province, we are not just embarking on a program or a COVID-19 project without being informed by data. We are driven by that and interventions that we have to make. Every day when the results come, we sit down and do a breakdown. Where are these new cases coming from? What is it in that area we have not been doing, and what is it we can do to ensure we contain the spread and ensure that we protect an area that may have been green as of low infection rate. It's also our concern, like Sidibeng district has been a low infection rate district. We also want to make sure that in the areas where the infection rate has been low, we protect those areas by these non-pharmaceutical interventions that include continuing to ensure the social distancing in that area, hygiene measures are implemented, and all the health protocols are implemented in those areas. We map them. It's not enough just to give you the raw data. We also map this with geomapping. The geomapping of all cases in Gauteng is something we do very well. The size of the dot on our geomap will show you that it is emerging as an area of big concern. So just look at that Carltonville area. The dot is much bigger, and the dot indicates the number of active cases. You would see that Ivory Park area and the parts of Tembisa. It's where we were concerned last week. But those dots you see, those dots are smaller than the dots, the size of the dots in the West Rand, in the Mirafong area, because of the intervention that we are putting in place to contain that. And some parts of Soweto are included in that. Some parts of Soweto, including the Dobsonville area of Soweto, on the western side of Soweto, right up to Protreed Lane on the south, you would see the number of positive cases, but also we're getting recoveries out of those areas as well. So mapping where exactly these cases are is also very important to inform our interventions. I want to run through this usual update. There's a number of people who have been immunized in the last 8 days. There's 10,000 more people who have been immunized compared to last week. And again, with immunization is targeting those who are most vulnerable. We don't just immunize everybody. Firstly is the public health workers themselves, the elderly, the children, pregnant women, and people who have chronic diseases, including those with HIV and AIDS. Screening, we have now screened 5.6 million people. Our target was to screen 5 million people by the end of May. If you may remember, those of you, at the beginning of May, we said to you that we want to screen 5 million people by the end of May. We have surpassed that target. We had said to you we want to be able to test 3,000 people a day. We have surpassed that target of testing. There are days that we test over 6,000 people a day in Gauteng, just as government, and this testing is targeted. Of course, I think we are concerned, like all provinces, we are concerned with the backlog on the results. And that's a matter that is being attended to by national government. The testing figures, we always give you an update on the testing figures. We get these figures overall, the national testing figures, we get them from the National Health Laboratory Services. Again, Gauteng contributes 33% to the overall national tests done so far, at 215,959 tests done so far. There's an important information that was released by the minister yesterday, which indicates the number of tests have increased. That 209,000 for Gauteng was the day earlier. We've just given you an update, including what is captured is only what's called community screening. Contact tracing, our province does extremely well. I'm going to give you an update on hospitalizations. The number of deaths remains the same in comparison to the rest of the country, other provinces. That's the national information released yesterday. So let's give you, as of today, an update on how many people are hospitalized in Gauteng. As of today, there are 203 people. 203. 173 of those are in the private sector, and 30 are in the public sector. So there are 203 people who are admitted in our facilities, both private and public at the moment. 173 are in the private sector, and 30 are in the public sector. 5 of them are under ICU, they are in ventilation. They are under a ventilator, and others are on oxygen, basically. We have a full breakdown there, including on room air. So, on average, the number of people, every 7 days when we brief you, we have had, on average, 72 people in our hospital. You can see the number of admissions has increased, and it is a matter that we watch very, very closely. So when we have the large number like this, relatively larger than we have ever had before, it is a matter that we watch very, very closely, because it is out of the hospitals where we have people who recover and others lose the battle against COVID-19. So that's an important area. The number of people who have passed on is still 31. Again, this looking at the hospital admissions is important because clinical interventions happen there. Our clinicians spend a lot of time doing tremendously great work to ensure that they save life, even those who are admitted in hospital, and a lot more of them are able to recover and get back to normal life. The number of beds that are currently available in the public and the private sector, that number has not changed, 8,301. Additional number of beds have changed only slightly. We took you to the Ashanti Gold Hospital. That hospital, we had targeted 200 beds in that hospital that is being refurbished. We took you there on Wednesday. But the design of everything there, the number of beds have been revised from 200 to 175 beds. So initially our plan was to have 200 beds in that hospital. But because of the design, when you do ICU beds in particular, the design is different. So we have lost 25 beds out of that redesign. So the rest, the work is now underway, that work of refurbishing and building additional beds with alternative building technology in the various facilities in Gauteng province. Our PPE stock, you would see it there, it was 11.4 million. It has gone down to 11.2 million, but we always have to have stock on order in anticipation of more work, including in anticipation of the peak that is still ahead of us, so that we have enough stock on supply. I just want to give you an update in terms of the number of people. Since the start of the national lockdown in Gauteng province, we have distributed 166,349 food parcels across the province, covering 831,000 people in Gauteng. We want to reach 1 million people, and we are confident that we will reach 1 million people soon. Every week when we update you, we have additional number of people. Now we are diverting all this intervention, diverting them to areas of high risk and areas of vulnerability, including where we are now getting new cases coming, especially in the townships and the informal settlements. The number of the homeless people we are providing food to is still more or less the same, 3,126 people receiving 3 meals a day in the 47 shelters for the homeless in Gauteng. The only update we can give to you is that the mining sector, our main focus, malls in Gauteng, and we are classifying the level of compliance of all the shopping malls, designating them as green. Green is full compliance. Amber is the one, a shopping mall that has got some significant compliance, but not 100%. But red is a mall that's not complying, and in those cases we are moving in. Where we have a mall that's not complying at all, we are moving in with law enforcement to ensure that if they don't comply, they basically have to shut down. So we have done a lot of work to look at compliance with level 4. We have done a lot of work to prepare for level 3. We have done grading of malls, as you would see them there, indicating which ones have been a problem for us and which ones have done better across the province. And we are doing checks, regular checks, not once-off checks. We are doing regular checks to just make sure there is a full compliance with the sector. These are some of the businesses where we had a problem. Farm-wise is the company that I was talking about in Centurion, where there was a cluster outbreak which caused problems for us in the Tembisa Ivory Park area, which got us to have significant new infections in that area. We made an intervention there, and we've also been looking at other businesses that are complying that we have visited so far. I would like at this stage to ask MEC Lesufi to do an update on the schools in terms of the readiness for the schools to reopen on the 1st of June. MEC Lesufi, please come and do an update.
Thank you so much, Honorable Premier, MEC Masuku, and Program Director TTG Thabo Masebe. I'm going to take you through on an update because last week we gave you our plans. So today we want to give an update of where we are so that it can indicate our readiness for the reopening of schools on Monday. We want to reaffirm the numbers that in total, if you have to count grade 12s and 7s in Gauteng, we are talking about 300,000 learners, and we are talking about 100,000 teachers and staff members. We are employing 4,000 screeners. We've changed that number to 10,000 now on the basis of the reports that we are receiving that there are some schools that have bigger sizes, and therefore we need to incorporate the extra number of screeners so that there are no queues or delays at the entrances. In terms of learners with special needs, we are bringing 3,000 additional teachers to support them. We call them teacher assistants, because in this sector, it's foreign to say that you are not going to touch a learner. Because there are some learners with special needs, you need to. There are some learners that, especially learners, means that you have to lead teachers that mandate, because now we've declared cleaning of school. All our general assistants, we've increased the numbers to 12,000. These are the people that must clean the school early in the morning, during the day, and in the afternoon to ensure that we don't have any form of infection, and also allow our school premises to remain clean as much as possible. This is the summary of the size of schools in Gauteng. We've got a total number of 2,071 public schools. And these public schools, we have linked them up with clinics. There are 413 clinics. Out of the 413 clinics, we are only concentrating of those clinics that will service our primary schools in terms of grade 7, as well as our high schools in terms of grade 12. And this is the allocation using the maps to indicate where each school is and where each clinic is. This is very crucial for our safety plan, so that if there is something that will happen in a certain school, we know there is a nearest clinic that will give an immediate advice, guidance, and support. And this is the cornerstone of everything that we want to do to protect our learners and also to protect our educators. And I want to extend my gratitude to MEC Masuku and the entire health department for providing this kind of support. It goes beyond that. We've indicated that they are the ones that are conducting trainings for us, the Department of Health. They are conducting trainings for all our EMTs. They're also conducting training, you'll see, for our youth brigades as well, so that we are guided by health experts. You don't assign a task about this virus to a teacher. You assign this task, a very important task, to a health expert so that they can provide training, but most importantly, they can provide the guidance on how to monitor the health screenings and also how to ensure that each and every teacher that have coexisting diseases, that they can be in a position to be assisted. The Department of Health is also bringing what you call environmental health practitioners. Each and every environment needs to be checked. And we are also bringing environmental health practitioners to provide that kind of assistance. And they've indicated things that they will do. For example, they will observe the safe distancing. They will observe hand hygiene. They will also identify the sick rooms, the sick bays, and all our isolation rooms to ensure that they are well known and they are seen, as well as on the availability and correct use of PPEs. I'll come later to unpack the level of PPEs that we've acquired and take you through each and every sector that we've allocated the PPEs, so that people must know the number of PPEs we are allocating and to whom. This is roles and functions that the Department of Health is going to provide to us. You will recall we made an announcement, and this is progress, that will get general practitioners, that is your local doctors that have surgeries in our townships, that they will start at our schools in the morning just to check if everything is in order. If there are teachers that are complaining of any diseases or something, the general practitioners will provide guidance, and also the general practitioners will receive learners that have symptoms that they've identified, so that they can assist us on providing the relevant health advice or guidance. This is another element that we are putting as a safety valve to ensure that our schools are safe, as well as our educators. We've indicated that we are going to recruit young people to assist us in our schools. We can give you feedback. The closing date was last week, Friday, and this week, today, I started their training. They're already in training. We've received 328,000 applications. Of the 328,000 applications, 223,000 met the requirements. Of the 223,000, we screened them down to 10,000. The 10,000 are the ones that are going to be deployed to all our schools. We're deploying 4 young people in each and every school, and we've indicated to them that they must behave, and they must be ambassadors that will ensure that our schools are safe, and they must not add to the problems that we already have within the schooling environment. What will be their task is data compilation. Every person that enters the school premises, they must register their name, surname, their address, their contact number, and their next of kin. They'll also do screening for us. Everyone that is entering the school premises, from a teacher, staff members, they will also do daily screening, identify the symptoms, and also provide the relevant information on what to happen. Those that need to go to isolation room will then be directed to the isolation room. They will also ensure that the sanitizers are available, they are always full, and they also utilize the PPEs correctly, and they'll also check the availability of those PPEs and ensure that the temperatures are recorded appropriately. So this is the task that we're giving to the youth brigade. 10,000 of them, as I said, we've streamed them down to 10,000, from 223,000 to 10,000, and they're going to be deployed over the weekend to go to communities. This is an ongoing program. Because we've received this number of young people that wants to assist, we are also identifying other areas where we can deploy them, either in providing administrative support to educators or doing other administrative work within the Department of Education. Because some of the learners some of the youth members that have requested to be part of this program, their qualifications are impressive, and we want to take advantage of that aspect. We've also made partnership with other NGOs that are expert in this field of good hygiene, organizations like Live Life, and we're also having a mobile clinic that will be moving to all our schools to ensure that support is provided to those that need support. I'm not going to bore you of our head office, but we can confirm we've concluded all the work that we've done at our head office. We are now dealing with capacity building, which means is training of trainers, people that will train those that need assistance. We are doing this task as well together with the Department of Health and our health partners. We are also contracting people that we really believe will provide the relevant support to the system. We are now bringing 88 professional nurses, and these 88 professional nurses are the one that will link with each and every school and ensure that each and every school have up-to-date minutes information, and each and every school, if they doubt something, they know that particular professional nurse to talk to. I've already indicated the general practitioners. The total number of those general practitioners is 4,753, and we're also bringing health promoters, that's 172, as well as data capturers. This is the role and the function of the general practitioners and the nurses that we're deploying to all our schools, and we're clustering some of our schools because some of our schools are closer to each other so that we don't waste time or we don't waste resources that we have at our disposal. We identified the following risks as a department because we want to deal with this risk as quickly as possible. I can confirm that a parent approached the department, a parent of a learner in Bronkhorstspruit approached the department to indicate that the learner is tested positive and they wanted the department to assist in identifying and tracing all the learners that were playing with this particular learner. We've executed that task and that mandate has been finalized. So we know that learner with the assistance of the tracing unit from the Department of Health. We've also identified the learners that played with that learner and the schools that they attend so that we can mitigate against that situation. During our training, we identified 2 teachers that tested positive. One teacher is at an independent school in Ekurhuleni. The other teacher is in our public school in Ekurhuleni as well, is a teacher at the primary school. We identified them during training outside the school premises. These 2 teachers have already been sent to quarantine and they've been isolated, and the schools that are going to work, the schools that they're coming from will be appropriately cleaned so that we don't have challenges. We also have one principal that tested positive in one of our schools here in Johannesburg. That particular teacher is in hospital, and all the contacts that the principal had have also been identified. And with the assistance of the Department of Health, this aspect has already been finalized as well in terms of tracing them and taking the relevant screening and test, and also providing the relevant results that can assist us on how to deal with this aspect. So we've concluded those 3 cases. They're very important cases, and at least we are pleased that we have managed to identify these cases before these educators can make contact with our learners. And the importance of testing has been vindicated, because in everything that we do, at the orientation programs, at our training networks, we test and screen all our educators so that we are quite sure that by the time the schools reopen on Monday, everything is in order. For our support to ensure that we don't have negative publicity or difficulties of issues, the Premier, together with the Executive, will be deployed to all our schools in all our regions to ensure that there is observation of all the things we have indicated that they will be available. We are also making a call that we accept that churches have been given a mandate to come back and worship, but we are pleading with all our churches, because majority of churches are utilizing our schools. We are pleading with all those churches that let's start discussions first to develop a protocol on how we're going to utilize our facilities before they can start worshiping in our schools. For now, we're requesting that they don't utilize our facilities until we've concluded this process. There is a team that in the Executive that normally meets with the religious leaders. The Premier has mandated one of the MECs to meet with the religious leaders to manage this aspect so that we can amicably reach a solution that will allow us to notify the churches that they must not utilize our facilities. The other thing that we want to encourage people to do is to use the Impilo Health app, especially our educators and parents. We really believe that this app will assist in identifying important aspects that they can utilize to ensure that learners are aware about their status and teachers are aware about their status together with the school community. I want to conclude by going through basic curriculum matters, because these are very important matters. Actually, these are the issues we believe that we should be tested against. Other issues of PPEs are technical matters. Education is about curriculum, and therefore, we really believe that we need to be ready to deliver curriculum. We can confirm that we have revised our annual teaching plans. These are very important plans because we have one curriculum as a country. The Department of Basic Education needed to then revise their curriculum plans and bring them to provinces. And we received those curriculum plans on the 25th of May. We've revised them and made them to be appropriate to educators. On the 27th of May, we are now distributing them to all our schools so that all the teachers that are coming will then be trained on the new annual teaching plans. The second aspect is that we are going to go ahead with the preliminary examinations. Those preliminary examinations are going to be written and concluded mid-October, because these are important examinations that learners must be ready to use those results to apply for higher education institutions. Thirdly, we've now finally concluded the processes of those parents that want to apply for homeschooling. If you are a parent, your child is at a school, say Tembisa High School in Tembisa, you go to Tembisa High School, you request the forms for homeschooling, they will give you those forms for homeschooling, and the school will then recommend to the district, and the district will recommend to head office so that we can get homeschooling. So whoever does not want to bring their children will be in a position to apply through the school that your child is attending, and the approval will be done within 7 days from head office. On the basis of that approval, will also give you the curriculum that you need to follow as a home scholar. The other important element that we want to bring to attention of parents is that if you have a learner with comorbidities, that particular learner needs to be registered at the school as well, and on the basis of the registration of the school, will provide online support and will also indicate the schools that may suit the caliber of the disease or the challenge that your child is facing, so that we can provide appropriate support in an environment that is conducive for everyone. We are also taking all our SMTs and our teachers for training so that they can conclude the parts that are crucial and the part that will allow us to open our schools and ensure that each and every school have the relevant support that we need. The last component, which is very crucial in terms of curriculum delivery, it's the examinations that are going to be written by our learners that are in other grades except grade 12s. We've extended the timetable for those examinations to be concluded mid-December, and the results will be available January, so that all learners can have their results and attend to all relevant matters. I want to conclude by confirming that we have now concluded the distribution of PPEs to all our districts. 9 of our districts were concluded yesterday. The remaining 5 districts will be concluded today and tomorrow, and on the basis of that, will allow all our schools to be opened from Monday. There are limitations. There are 3 schools that we have serious limitation. One school is in Alra Park in Ekurhuleni. This particular school, unfortunately, the entire fence was stolen, and we are very careful to allow that school to open, because you will have people going directly to the classroom rather than going through the screening. There are temporary measures that we are putting in place there to assist us to eliminate that aspect. There are 2 schools that have challenges of water and sanitation, and because we said safety first, we've advised those schools to wait until we've acquired the necessary tools that will assist them to use sanitation and also to have access to water. These particular schools are in our farming communities, and we really want to work together with the farmer to assist them to deliver the relevant resources that we need for those particular schools. In the absence of the issues that I've just indicated, we really believe our schools are ready. They are at different levels. There might be schools at an advanced stage. There might be schools at an average stage. There might be schools that are behind. But on the 1st of June, we'll allow all the schools in Gauteng to open, and will provide the relevant guidance and support. On day 1, there won't be a lesson like accounting equation or a lesson in physical science. On day 1, all learners will be taken through on how to wear mask, how to respect the mask, how to interact with the teacher, the importance of social distancing, how to always sanitize, and how to ensure that in everything that they do, they don't exchange saliva through ballpoints, through rulers and others. And so day 1, June the 1st, continues to be an orientation program for both educators and learners, and we expect from Wednesday, that's when we will then start to ensure that lessons continue. We've emphasized this particular point and want to emphasize it, that every teacher, before they release or they start teaching our learners, they will explain to learners what is COVID, and they will give new information about COVID so that our children can be part of this new order and they can understand the situation that we find ourselves in. I want to wish our educators well. I want to wish our learners well, and I want to assure parents we've done everything humanly possible to ensure that our children are not only safe, but they learn in an environment that is conducive and that will assist in their personal development. Thank you so much, Honorable Premier. Truly appreciate the opportunity.
All right, thank you very much. Yeah, go and just start, introduce yourself.
Thank you. My name is Nozintombi Mia from SABC TV News. I think my questions are more for clarity. I just want to understand next week, when more people go back to work, of course, we'll be seeing a surge in cases. For the Premier specifically, how will you deal with the issue of the outbreaks, specifically in Ekurhuleni and the West Rand? There's been a lot of issue around the issue of screening and testing in Gauteng. The Gauteng figures have been, there's been a lot of skepticism with regards to how the figures are collated and processed. So with regards to that, we just want to know how reliable and accurate and transparent are those numbers with regards to Gauteng, and how will you address the issue of the backlogs? For the MEC of Education, with regards to the issue of schools, there is an anticipation that there would be an increase in the number of positive cases, obviously as the pupils go back to school. In spite of the interventions that you've just spoken about now, what interventions further do you have in place to deal with the surge in the numbers that are expected in the next coming weeks? Thank you.
It's Mangoba Mkuno from ENCM. I just wanted to ask first for clarity on these ward-based teams that have been deployed. How many of them have been deployed, and will they be only dealing with hotspots, or will they be across all those different wards on a daily basis? And then secondly, with regards to places where you see, or hotspots where you find that there's a sudden surge and the numbers spiral out of control, what's the likelihood, Premier, that we'll see some of those hotspots moving to higher levels, for example, moving to level 4, level 5? Is that something that will be considered should there be a sudden spike in a certain hotspot? And for the education MEC, can you give a guarantee to all parents that their children will be safe on Monday if they send their children? If they send their children to school on Monday?
Okay, is that all? All right, sure. Go ahead.
It's Ndaedzo from Power FM. Just a quick one. The Premier is mentioning moving, or at least the Western District being classified as a hotspot. Yesterday, the Defense and Military Veterans Minister, Nosiviwe Mapisa-Nqakula, said that they would be deploying law enforcement agencies and beefing up law enforcement in that area, in those so-called hotspots areas. But you've got, what, 2-3 days before we move to level 1. Is that an engagement that...
Level 1? Did you say level 1?
No, sorry, level 3. Okay. We've got 2-3 days until we get to that level 3. Do you then want to have those same interventions that one would be experiencing in Ekurhuleni, Joburg, as well as Tshwane, to also be moved to be deployed as well in the Western District, just so that there's some level of compliance, because as a province you have identified it to be at the same level with the 3 metros? Thank you.
Okay, is that all? All right, we also have a few questions that we received. One from Brian Sokutu from the Citizen. How does the Gauteng government plan to intensify public education in hotspot areas and two densely populated areas like informal settlements are likely to pose a challenge in winter? How is government responding to that, and how much resources will be plowed in such areas? Then there's another question from Tsepo from the SABC Radio. With the projected increase in fatalities, how capacitated is the province for possible mass burials? I guess this question will stay with us. Okay, that's all we have. We will answer the questions. MC Masuku.
Thank you, ladies and gentlemen. Good morning. I think I'm just going to touch on the few questions. I think starting from the ones that were said. I think the statistics that we are using, the data that we are using, it's a national data from NICD. So Gauteng doesn't produce its own data. Nozintombi, it's just the data that comes from national, including the data on backlogs that you actually spoken about. Yesterday, the minister released that we are, as Gauteng, we have recorded 209,657 tests, and we've got a backlog of 24,000 that have not been processed. And this is just what we are having, and that's the data that comes from national. So we are not in any case doing anything to the data except to analyze it and be able to plan our actually response to the actually to it. And maybe also just to touch on the issue of the testing, because part of the backlog that we have, we also do the age analysis on the tests, because we have to see how old or how long have we been waiting for the tests. And the most crucial part is the 2 weeks period, because there are people that have been patients under investigation for over 2 weeks. And if they remain asymptomatic, those are patients that would regard as actually recovered, because that's how the disease process is actually been measured in terms of the 14-day period. And in terms of what we have to do with the backlog, like I've said, we're doing the age analysis, and those that we require more agent results, we've enlisted a group of private laboratories which processes those actual specimens, and we direct them to the outbreaks. Like the outbreak in Mirafong and the numbers that we got, it's not old results. It's not like it's results from 2 weeks ago. It's recent results that we have been able to actually to get. So we are redirecting them in hotspots. We are redirecting our capacity in the outbreaks, and also including the outbreaks in hospitals and in our clinics. And the other issue about it is that we are going to announce the partnership with one of the mining companies, Anglo Gold American, Anglo, is it? No, it's Anglo American. with their machines, which they are going to offer us 2 machines that we'll also use in terms of the outbreaks. So all this that we're trying to do now is that we're going to be prioritizing testing, prioritizing outbreaks, prioritizing hotspots, prioritizing patients that are in hospitals and that require confirmation. And we will be able to do exactly that going forward. And I think the issues of the backlog, there are other matters that the minister will have to address with the experts on how we can also change our techniques in terms of the processing of specimens. And I also just want to indicate that I don't know how it will come out, but the issue of stopping the spread versus managing the spread, it's something that we need to clarify, because there will be a point where people will confuse the two and they will consider increase in infections as a failure in government. But I think the issue here is that we need to be tested or to be assessed on how we have managed the spread instead of stopping the spread. Because when we say we are going to stop the spread, we might be giving us a task that might not be able to be achieved, and it will be just an issue that might not be okay. But the issue is that all the measures that we're talking about, social distancing, wearing face masks, particularly the cloth masks, making sure we avoid overcrowding, still being at level 3, that most of the regulations will still stay. It's all about managing, the spread, and so that the spread is managed and it's slowed down, so that we are able to have capacity in our health facilities to deal with those who will require hospitalization at a given time, and I think that's the most important aspect. The ward-based teams, at the moment, they will be prioritized and focused in Makhura, will be focused in the hotspots and where the outbreaks are. And I think the work that has been done in West Rand, particularly in Marafong as we speak, it's one of the work that the ward-based team will be doing. But besides the work that the ward-based teams will be doing is the issue of enforcement and monitoring of these regulations. We still feel strong that our security, our police and our army shouldn't be the ones that are doing that part of work. So in part of the ward-based teams, there will be members who are medical practitioners or who are health professionals who will also be helping in public health education, in educating the public about these regulations that we talk about, the hygiene habits that we need to adopt as a country. And I think this is how the compliance would be done. And the levels, we would have to do it differently, but the most important aspect is to remove individuals who are infected, is to remove people who can't self-isolate in that particular community. So it's going to be a different approach in that way. It's something that we have been doing, but I think now we will be doing it quite more, particularly in areas of hotspots and outbreaks, rather than going back to another level. And that also, we have to also indicate that the decision made about levels, it's a decision that comes from the National Command Council. So as a province, we wouldn't be taking a decision like that, but managing hotspots, managing outbreaks is what we would be doing actually going forward. The issue of mass burials, the Premier will also address this matter, but we are not in any way thinking that we are not going to get there. The issue is that we are preparing. We have enough grave sites in the province. We are working with our municipalities through the command center in the province, and we have made that audit. We know how many graves, where we would find them, even the capacity of cremation in the crematorium that we have, and it's something that we are preparing. It's not a very comfortable discussion to have, but we have already actually planned around it, and it's something that we are doing. So public education will be strengthened and amplified by our ward-based team, because that ward-based team, we're talking about multi-sectoral, multi-departmental, and also be led by public health experts to make sure that we're able to deal with those areas. And I think maybe just to emphasize a few points, because I think the questions on school infections will still come. That's why I started off that the issue is that we have to manage the spread, but it won't be possible to completely say that we will be able to stop the infections. But we will respond to infections as we'll respond to any other space, where they are. So one thing that we need to insist on, that it shouldn't be a secret. All our managers of facilities, whether it's school principals, whether it's a company, anywhere, they need to have a standard way on how they're going to respond to an infection, infected individual in the space. And we need to make sure that there are compliance officers who will make sure that those standard procedures are actually done all the time, same way, similarly, and with the requisite speed. So we have already in the health department have a rapid response teams that are in all the 5 districts, which respond to every situation in our facilities to make sure that we give support to the managers and the steering committee at the facility to do that. But our managers and CEOs have been requested and have been encouraged that these infections shouldn't be kept a secret, because this is a notifiable disease and it carries a big thing. So it's a message that we'll continuously actually give them to make sure that we do them in that way. So in that regard, I think the standard way, to make sure that we respond with precision to every time and have a similar way on how to deal with it, because we want avoid a situation where there won't be any infected patient or an infected healthcare worker, but we just have to have a way which we already have put into place and which we've already been exercising to make sure we're able to deal with the situation with precision, and also using we use material and chemicals that have been approved by scientists and have been approved by our standard bureau, particularly if they meet the ISO in terms of quality assurance. Thank you.
Thank you so much, MEC Masuku, for responding to that question. And that's how it's going to be in Gauteng of health, because this is a health challenge. The Department of Health will guide us and is going to work together. So, as we've indicated, that in our schools, we'll leave that task and that guidance from the Department of Health, but also to guide us. But we really believe that we put in place, we remain of cases in our schools. We really believe we need to protect.
Hey guys, as you can see, I'm getting ready for P40 series launch live stream. Guys, I'm so excited for this one.
And that is why we are emphasizing the message, safety first. If you are in doubt, take a step backward. Let's clear the area of doubt, and when all of us are fine, we can then be in a position to go to the next stage. You will see, even in terms of the delivery of the PPEs, we've delivered them into 3 phases. The first phase was SMTs. We concluded that part. Every SMT had their own PPEs. We then moved to the next phase and combined the next phase of phase 2 of giving to educators and learners, and combined it because of the timelines. And that is why we are saying, even areas where they will receive their material today and tomorrow, come Monday, we are not going to jump any stage. If there is orientation, that orientation must be executed. If there's orientation for teachers and orientation for learners, the orientation of educators will be conducted by district officials, while the orientation of learners will then be later executed by the people that were assigned to go to school to assist us. So each and every phase is going to be, we're going to go through that phase, and we're also going to provide support to all the people that need support. So to the SABC, we remain convinced that we have to ensure that there's no surge in our schools. But if there is, the Department of Health is going to provide the relevant guidance and support that we so desperately need. Mangoba, if we have to give guarantees, I can assure you that the guarantee that we are going to give is that our schools are going to be conducive for learning. That all our schools are going to be conducive for learning. If there are schools that are not conducive for learning, we'll be the first one as a department to ensure that those schools are indeed conducive for learning, and we can give those schools the relevant support that they need. You will see from our strategy and all our plans that the district offices are now our war room. They are now our center of support, so that each and every school must feel supported, each and every school must be guided, and each and every learner must know that everything that we need from them, they can get whatever that they need from us. You will see from our plans that there are daily reporting as well. That each and every school, every day, they must give us a report. Do we have sufficient masks? Do we have sufficient sanitizers? Is the school still clean? Are learners cooperating? Which areas are we facing difficulties? So that we can then assist the school to overcome those difficulties. We've never been here before, all of us. And therefore, there will be an element of trial and error there and there. But in doing that, we have to ensure that our children are protected and our staff members are supported as well. Because if you can't support learners and you can't support teachers, then you don't have education. Because these are the people that are delivering education in our province. And we want to assure all our educators, we've got their interest at heart, we've put all the relevant systems to ensure that they are supported, but most importantly, we expect them to give our learners guidance and to protect those learners so that all of us can be protected within the schooling environment. So the 1st of June is the beginning of normalizing our schooling environment. And there will be elements that are still outstanding, but we'll provide the relevant support to clear all those outstanding elements so that every learner can be safe and every teacher and staff member can be safe as well. Thank you so much, Honorable Premier.
Let me conclude by just emphasizing in terms of the questions that were asked and responded to by my colleagues, the MEC for Health and the MEC for Education, conclude by saying that, yes, Nozintombi, we are moving to level 3 as the whole country. The advantage of moving to level 3 is that more people who were not working will return to work. That is the advantage. But we also know that reopening also poses risk. That's why our country follows a risk-adjusted strategy. All that risk, sector by sector, the risk has been analyzed. And that is why we have spent so much time focusing on and engaging with various sectors for compliance. And we think this message has gotten to everyone, that every business should be able to provide evidence, even those that are not open now. And I know others who even have gone to court, others are engaging with national ministers, engaging with us that are not open, that say, we can provide an environment in our businesses which identified as high risk. Let me tell you which one. You and I would be happy if they open. Look how my hair looks like now. You and I would be happy. But we say to them, every sector, even the ones that are not open, all they need to do is to provide, is to be able to say, we will put in place these measures that should be able to ensure that people are safer and that we are not going to become a vector of infections. That's the message I want to, I think, move these levels, level 5, level 4, now level 3, and others, as the ministers were saying, others will move to level 2. There may even be others that may move to level 1, some parts of the country, and the president also made that quite clear. The critical thing is that in areas where infections have happened, and they may still happen, all we need is to demonstrate how we are going to ensure infection control. So infection control used to be an issue for the health workers in certain parts of our health facilities, infection control measures. But we, given the pandemic, we need infection control to be nationalized and be made a common thing for every sector, for households, infection control, how in our own homes, how in our workplaces we will do infection control, because there is no vaccine at the moment. And the virus is here in South Africa, and the numbers are increasing every day. We see that. The difference is what can we put in place to ensure that we slow down the infections, we contain, even when there's an outbreak, there's a prompt response. If there's an outbreak in an area, in a factory, in a hospital, there's a prompt response, and there are measures to ensure that we will be able to contain that. So we will not prevent completely. The virus is here. But we can do a lot to put in place measures to contain how fast it spreads and how many people it spreads to. Social distancing is one of the principal things about social distancing, is just to minimize the contact, because that's how the virus moves. If it is in someone's body, it will get to the next body through contacts. So we want to emphasize that, given the fact that all science now says we will be in this for much longer, closing the economy is not sustainable. So whoever argues against moving to level 3, closing the economy is not sustainable. What are you going to do to ensure that people have the means to support their own livelihoods? And we may be in this for 2 years. That's what the scientists are saying. We may be in this for 2 years. It's no longer, earlier on it was thought this will come quickly, 3 months. Over 3 months we would be done. We'll be over the peak. Now it is clear, science points to the fact that we will be in this for long. That is why some measures to protect and save lives must coexist with opening the economy. And many of us who are in positions of responsibility, assigned by our own system of democracy, should be worried that any sector you open and increases the chances for more people interacting, for movement, mobility in our transport system. That's a very normal concern, that we should be concerned that, yes, reopening more, but risk-adjusted precisely means that when we open up, we must deal with the risks. We must put in place the measures to minimize. When you know the risk, it doesn't mean you mustn't do something when you know it's a risk. That's precisely what risk analysis means. It means you make a decision with your eyes open, knowing that, and essentially there's no movement, there's no progress without risk. There's no progress. But you need to understand the level of risk. You need to put in place measures. Our children cannot be at home forever. But again, how we open the schools, we have to put in place all measures. We can't have all the children going to schools at once, all of them. And when parents decide that they don't want their children to go to school, how do we support those parents? All this. So it is a new thing. The president often says this, that this uncharted waters. Anyone who just thinks they have an answer, they are living in their own world. So we welcome criticism, and I must say to you that I think those who say don't open, they don't have answers to these workers who say, I came face to face with mine workers in the West Rand on Wednesday. The union members, 4 unions, were speaking with one voice. They were saying to us, yes, we have had an outbreak in a mine, but we don't want the mine, we want the sector to be open because we workers want the sector to be open. We want to come to work. We want to earn incomes, but we want to make sure that the opening is done under conditions of guaranteed safety. They made it clear to me that, Premier, we don't want the mine to close down. We are an immediate victim when the mine closed down. But we want you to work with us and these mining companies to make sure that the mines open under conditions of safety. That comes directly from the union representatives in the mines who said, yes, you must be very hard on the mines that don't observe protocols, but we don't want the sector to close down. They said that to me. Premier, we don't want the sector to close down. So I think we are moving to level 3 as a country to open more sectors of the economy. Is there going to be risk? Yes. Increased levels of risk. How are we managing that? We are going to manage that with all the measures, even with the public transport system. We now need to move into the next level, at least with the taxi industry, with the buses. We have measures in place. The trains, Minister Mbalula is working with our MECs to deal with that matter. But you cannot have sectors of the economy closed forever. Even those that are not open now. I can tell you I get lots of messages from people in the hairdressers and the barbers and people in the care sector who say that we are suffocating now. We don't have money to even pay for rent. And I want to say to them, I think the best way is to get every sector to put in place measures like the religious leaders. We're saying, often people ask this question, but how do we allow the church? The religious leaders will say, all these measures that you say must be put in place by the schools, by the workplaces, that we as the religious leaders can also do the same. We can reduce the numbers. We can, in fact, a lot of the things that were announced by the president, a lot of these things they were saying, you are putting these measures for the schools, for workplaces, for businesses. Who says we cannot implement those ourselves? And my point is that I think if we can say to everybody that these are the measures that you need to put in place, prove that you can minimize the risk and help contain the spread. You are not going to be a vector. You are not going to be a source of a cluster outbreak. If you put those things in place, we should be able to say a sector should be open. But that decision will be made by the National Coronavirus Command Council. We in provinces just work with sectors to enforce compliance. I have heard the stories about the Gauteng numbers. You would know, Nozintombi. There were many stories. They change. And they come from the same source, if you like. The outbreak is the same. It's a particular party and we don't want to engage in party politics. We are dealing with a pandemic affecting the whole world and the whole republic. My point has been, let's deal with the pandemic. We must not politicize what comes out of COVID-19. If there is a particular area of a district or a province needs support by national government, it needs support by national government. And I'm very happy that the national government has been responding the same. We are going to provide support if we are concerned that in a particular area the infection rate, including the mortality rate, is going rapidly high at one point or the other. The national government we need that support here, even at the rate we are. You can't manage a pandemic ideologically, by a party. And every state that comes out is interpreted using ideological spectacle. The numbers of Gauteng must be seen in a suspicious way. Only the Western Cape numbers must be treated as, that's ideological nonsense, basically. People are dying, people are getting infected, whether it is in the Western Cape or in Gauteng or in KwaZulu-Natal or in the Eastern Cape. They are our fellow countrymen and women. We have to do everything. It must worry us when people are dying out of the pandemic. It is not based on what party they subscribe to. So that party nonsense of saying Gauteng numbers must be treated with suspicion by a leader of a certain party who tweets that all the time, that's party nonsense. Let's focus on fighting the pandemic, and not. I know where this get brought. Corona broadcast or Corona cast. That's where that nonsense is being churned out. And let me tell you, here in Gauteng, I am working with all the parties. We meet every week with all the parties represented in the legislature. Our approach is the same. Let's work together to protect our people, guys. This is a pandemic. It knows no politics. It knows no ideology. It knows no color. It knows no gender. It knows no class. Of course, its impact, it's uneven. Those who are women and who are working class people and poor people will be hardest hit. They don't have medical aid. But the infection goes everywhere. So we are not celebrating when the numbers are high in the Western Cape. That's heartless to do. And we are not wishing them bad as this party leader thinks that, no, we wish the Gauteng numbers can just be high. That's nonsense. It's heartless. We don't want that. We are fighting a pandemic. We must be doing this together. It must be our worry when the pandemic is spreading anywhere. So this thing of numbers, the numbers talk for themselves. So national numbers. So firstly, this party leader said that we were not testing enough. The numbers now are no longer released by us on testing. Firstly, there was a claim that no, a particular province is testing more people a day than any other part of that has been disproved as false. And then every day there's a new story. Oh no, they are not testing where it matters most. They are just testing everybody. That has also been disproved. It has been proven. Our strategy of and then another story was they are not tracing enough. So there are people out there who are infected, they are not tracing. Now you see the report from the Minister of Health says we trace at 100%. Sometimes 98%, sometimes at 100%. That thing we have strategy. Now, we have done that even in the early phase. In Gauteng, the hotspots in the suburbs, we were watching them all the time. The contacts as well as those who are positive. So those hotspots are now proving recoveries, more recoveries. And there are hotspots where there's 100% recovery. In other words, there's no more positive case in those hotspots. Now we are moving into new hotspots. They need a change of tech because the township hotspots are different from the suburban hotspots. You have high density settlements there. And for that, for that reason, our approach in those hotspots. That's why we have ward-based teams. You can only do that at township level because you want to reach people street by street, house to house. If there's a street and an area where people just don't observe, like I was in Ivory Park, they don't observe social distancing, they don't wear masks, they still crowd like there's no coronavirus. You get a ward-based street-level team, the people who live there, to say to them, people, we are going to die if we don't do these things. It can't be the police who come to arrest them. That does not work. Actually, it's reactionary to use the police in that manner. The police job must be to deal with those who break the rules. But public education, public awareness should be the work that we do to mobilize. And I can tell you the countries that have done that have done extremely well. We have looked at what the state of Kerala in India has done. How you get grassroots mobilized. The grassroots activists live in those areas. The activists who have been working in the campaign against HIV and AIDS in those areas, they know everybody in the area. So that's what our strategy is. Draw the church leaders as well. We want them to be held accountable. If you open a church in the area, it must only be because there will be compliance. If there's another church that doesn't comply, we work with the religious leaders to ensure that there should be no church that doesn't comply. But we do that with the schools, we do that with the businesses, we do that with everybody. So our mobilization, the word-based approach, is an additional new approach that we are embarking on, especially in high-density areas in townships. So, and that, I also know that Brian Sokutu also asked that question about public education. We are investing now a lot in public education by making sure that it is the mobilizer. We're going back to what we know best, basically, mobilization, local mobilization. Get community activists who are interested in saving lives to be part of one type of they are not going to gather as a crowd because this must only be done in accordance with the protocols. But they must be actively involved. I know in that street people are not complying. What can we do? Young people gather in a place, there they play soccer, and then it poses a threat. How do you get young people to be involved in ensuring that other young people are going to comply? So that's essentially our strategy. So I am not perturbed by a political party that always pours cold water on our numbers. I'm not perturbed by that. I'm going to focus on the battle. The battle here is the battle against the pandemic. And I would like to say, I work very well with the Premier of the Western Cape, Premier Windy. I work very well with him, like with all the other premiers. We must focus not on shifting the blame. Think that, no, if there's a problem in my house, I must look at my neighbors. My neighbors are the ones. If my children don't go to school, I must blame my neighbors. No, I must pay attention to my children. If my children don't go to school and they don't like schooling, I must pay attention to them. I mustn't look at the neighbor and say, no, because the neighbor is influencing my children. We are facing a huge pandemic. We in Gauteng are prepared for the worst. I want to repeat this because we can never send a message to our people that we are over the moon. So far, over the past 2 months, we have been able to do our best to contain the spread and the numbers, but we don't know what the trajectory of the pandemic will be over the next 2 months. As you see, we're now looking at, even if there are just 10 people in a particular area, we are looking as to whether the number is increasing every day in that area. We are tracing that. We want to make sure that we contain the spread. And lastly, the deployment. Yes, the team. Yes, yesterday the security cluster gave a briefing later in the late afternoon. about how, from a security cluster point of view, they are going to contribute to the management of hotspots. So we shared with you today, we shared with you the health response and the community response on the hotspots, mobilization. But there will be a law enforcement response, which, yes, the Minister of Defense was able to share that increased levels of deployment of the law enforcement and security forces in the particular areas to ensure that part of the containment measures may include limited movement. And one thing we can't rule out also is that if a smaller area of a hotspot, let's say a particular community becomes really a source of outbreak, we may be forced, yes, to just contain it in that community to make sure that we almost closed off that community. If a particular local area poses a threat on the spread to other areas, who knows? You may find that that area, and in fact, it is also a question that Makhura, you were posing. Yeah, you may have a localization of level 4 and level 5, stricter measures at a lower level within a district that may be a hotspot. In fact, let me tell you, when we had an outbreak in the Tembisa Ivory Park area 2 weeks ago, one of the things we were basically exploring is whether we must close off completely that area. And after we did a risk assessment, a full risk assessment, including the benefits of that and the work that was done for doing testing in those areas, we found that it's not necessary to do that. But we can't rule that out. So, but if we have to do that, we will also consult with the National Command Council. I think we look at the point about hotspots is look at what the criteria is, look at the numbers. It's not a secret. Hotspots are not declared secretly. The criteria is public. A certain number out of the 100,000 population, or a spike, a significant spike in new cases just coming out of, that's what a hotspot is. So you can be able to see a hotspot every day, whether it's declared or not. And the important thing is that once you see it is a hotspot, that this area becomes a hotspot, you need to mobilize all the resources. That's what we have been doing in Gauteng province. Mobilize all the resources to direct them, all the interventions to ensure that you contain the fire there and put down the fire in that area. Is that what we have been doing in Gauteng? Yes. We have been doing that. And we are going to continue to do that. We are going to draw important lessons from this ward-based response teams as well. But we are also preparing for the West in terms of the graves. We have been meeting with municipalities. All I can say is that we are ready across the province. Whatever comes our way, we will be able to handle this situation. Of course, we are guided by modeling. The group of data scientists and epidemiologists who are advising us in the province, also working with our national team that advises national government. We do everything based on that. If they say to us, your calculations on the number of ICU beds is too much, we revise that. If they say, no, you have not planned enough for that, we also look at that. So we are driven by science on this. We're not driven by particular ideology when we deal with these issues. And I would like to appeal that in Gauteng, I think that's going to be the approach. I am very happy that we have had a lot of support from all the political parties in Gauteng that we must work together. This pandemic requires a national response. all the kind of things that from time to time come have proven to be false. So Nozintombi, our numbers can only be verified and confirmed by national, and we're just doing the work of ensuring that we are counted amongst those who did their best to contain the pandemic that hit the world in this period. It doesn't mean what comes ahead, we will always be successful, but let's kick this ideological riffraff out of this. It is a pandemic. It needs us to respond as such. Thank you so much. We are done. Thank you so much.